My name is Dr. Jen Simonson, and I'm the Clinical Director of the Boulder Valley Vision Therapy Center in Boulder, Colorado in the United States. I have a fellowship in vision development and rehabilitation, and then a second fellowship from the American Academy of Optometry, which is a little bit more on research-based care. And so I'm very excited to be here. I'm good friends with Stanley Tien, and just completely amazed at the quality of care and the depth of knowledge, and just the goal to really help patients. So I'm excited to share some of the tips and tools that I use in my therapy clinic with all of the people that came today. I've been absolutely just amazed by the level of knowledge and of care and just patient-focused care that I've experienced so far. The doctors definitely want to learn how to best assess those patients and make good recommendations. It may be lenses or tints or Prism, but also to offer vision therapy services, which is not available everywhere, to help encourage that development in the right way. Also, for if we have an injury or illness, that we can rehabilitate so that our eyes are working comfortably and they're working accurately and they're working quickly, so we have good efficiency and comfort throughout the demand of our days. So they just have a lot of the tools available to them to really give high level exceptional care. Wonderful question. So we have the same exact experience where they have children that are struggling and making complaints, yet they go to the eye doctor and they have normal eyesight. And that is because eyesight is just one piece of the skills needed to see well. First of all, a lot of eyesight is measured far away at distance. That's not where we hold our book or look at our computer screen. We're not even assessing how their visual system is working up close. So the big thing to know is you want to see a functional, developmental, behavioral type of neurospecialty doctor that's going to actually test to look at the tracking skills to make sure they're not skipping words or skipping lines or missing information, but also the processing to make sure that they're actually seeing the word as a whole and being able to perceive that correctly. So it is a very different exam. It's always worth even doing the testing because you learn so much about your child's vision. They don't know how they're supposed to see. And parents, we assume they see the same way that we do, whereas often they don't. The very first patient I ever had as a vision therapist actually saw double vision. And so they didn't realize they saw double vision until the exam. And of course, they're like, one mommy, two mommy. And the mom just cried. They had no idea that part of the reason we couldn't write or spell or read is that we saw overlapping or double images. So that is something we just want to catch early. There's a lot of things we can do to fix that. Again, we're not necessarily teaching reading, but the visual skills needed to see the information accurately as we track across the page comfortably so we can read for a long time. So big things to look for is like, if we have to change our posture or viewing distance to see better, then it is from our eyesight that we're having difficulties. And if it is where we're tracking or skipping, it is with our eyes. So we want to make sure that all of the mechanics, the nerves and the muscles are really coordinating the two eyes to look at the same place at the same time, which we call binocular vision. So we want to make sure that coordination is optimized for reading efficiently.